Welcome to Daily Health and Wellness Hacks. In this episode of our Vitamin D Deficiency Series, we're uncovering why infants and elderly individuals are at the highest risk of vitamin D deficiency and what they can do to stay healthy naturally. Vitamin D is crucial for our health. It's often called the sunshine vitamin because our bodies produce it when exposed to sunlight. Vitamin D helps our bodies absorb calcium. This is vital for strong bones and teeth in people of all ages. It also plays a role in our immune system, helping us fight off infections. However, infants and the elderly are often at a higher risk of not getting enough vitamin D. This deficiency can lead to several health problems. In this episode, we will explore why these groups are more vulnerable and discuss how to improve their vitamin D levels naturally. Disclaimer: this video is for educational purposes only and does not replace professional medical advice. If you suspect a deficiency, consult a healthcare provider. Infants are particularly vulnerable to vitamin D deficiency for several reasons. Firstly, their delicate skin is more sensitive to sunlight. Parents are often advised to limit their baby's sun exposure to prevent sunburn. While necessary, this precaution can reduce vitamin D production. Secondly, breast milk, while the best source of nourishment, doesn't contain sufficient vitamin D. This makes it essential for breastfed infants to receive supplements. Lastly, infants experience rapid bone growth, requiring a constant supply of vitamin D. Any shortage during this critical period can have lasting effects on bone health. Adequate vitamin D ensures their developing bones grow strong and healthy. As we age, our bodies become less efficient at producing vitamin D from sunlight. The aging process leads to thinner skin and a decrease in the number of vitamin D receptors. This means that even with adequate sun exposure, older adults may not produce enough vitamin D. Furthermore, seniors may spend more time indoors, reducing their opportunities for sun exposure. Limited mobility and health issues can limit their time spent outdoors. Less time outdoors translates directly to less vitamin D production. Vitamin D deficiency in the elderly is linked to weaker bones, increasing the risk of falls and fractures. It also contributes to muscle weakness, increasing the likelihood of falls and making recovery more challenging. Vitamin D deficiency often goes unnoticed because its symptoms are subtle and can be mistaken for other conditions. In infants, signs include delayed motor development, muscle weakness, and skeletal deformities like rickets. These signs often appear gradually, making them difficult to detect without close attention. In the elderly, symptoms include bone pain, muscle weakness, fatigue, and increased risk of falls. These symptoms can significantly impact their quality of life and independence. It's crucial to consult a healthcare professional for proper diagnosis and treatment. Early detection and treatment are essential to preventing long-term health complications. Addressing vitamin D deficiency is always better sooner rather than later. One of the most natural ways to boost vitamin D levels is through safe and responsible sun exposure. For infants, short periods of sunlight exposure, even during routine outings, can be beneficial. However, it's crucial to avoid exposing them to direct sunlight, especially during peak hours. Always protect their delicate skin with hats, clothing, and shade. Older adults can also benefit from spending time outdoors. Even a short walk in the park can make a difference. Encourage them to apply sunscreen, wear protective clothing, and seek shade when necessary. Remember, moderation is key when it comes to sun exposure. While sunlight is the primary source of vitamin D, certain foods can also contribute to our intake. For infants, formula milk is fortified with vitamin D, ensuring they receive adequate amounts. As they transition to solid foods, introducing options naturally rich in vitamin D is important. Fatty fish like salmon, mackerel, and tuna are excellent sources of vitamin D. Eggs, particularly the yolk, also contain a decent amount. Additionally, some mushrooms are exposed to UV light to increase their vitamin D content. For the elderly, incorporating these vitamin D-rich foods into their diet can help maintain healthy levels. However, dietary changes alone may not be sufficient, especially if a deficiency already exists. In such cases, supplements may be necessary to bridge the gap and ensure adequate intake. Sometimes diet and sunlight aren't enough to maintain optimal vitamin D levels. This is where supplements come in to bridge the gap and prevent deficiencies. For infants, especially those exclusively breastfed, vitamin D supplements are often recommended. Elderly individuals may also benefit from supplements, especially with limited sun exposure or dietary restrictions. Consult a doctor before starting any new supplements, including vitamin D. They can recommend the appropriate dosage and monitor for potential interactions with other medications. Supplements should complement a healthy lifestyle, not replace it. They are most effective when combined with a balanced diet, regular exercise, and adequate sun exposure. By taking a holistic approach, we can help ensure infants and the elderly receive the vitamin D they need to thrive. Stay tuned for the next episode. Next, we'll talk about vitamin D deficiency in people with darker skin and how to address it effectively. Make sure to subscribe and turn on notifications so you don't miss it.